Joe Buss, Moorestown voter here. Joe, you're against the health care plan, but John Adler, you're not against him, even though he's a Democrat. You thought maybe his no vote helps you in your mind.
Well, yeah, I believe so, because I think he votes for what he thinks is right and doesn't have the need to vote along party lines. And he's a first-time congressman, and I respect what he did.
You don't think he was doing that to make people like you happy?
No, I don't believe so. I believe reading his bio and listening to him speak and how he is on the issues, that he's an honest man who goes for what is best for the people and best for this country.
This morning, the late-night passage of the health care reform bill. New Jersey Congressman John Adler opposed the bill. He told you that last week right here on Good Day. Joins us now live. John, thank you. Congressman, thank you for being with us on this morning. I know you probably haven't had much sleep, so let's get into this. You said you were going to vote no, and you voted no. Remind everybody why.
Well, my father was a dry cleaner who couldn't afford health insurance in his small business in Haddonfield. I know the struggles of businesses. I know that folks need to have relief from premium increases of 15, 20, 30%. I don't think this bill does it. So I think lots of folks who get insurance through their employers are going to struggle with the fact they might not see wage increases for a couple of years or longer as businesses have to shift more and more money to pay for premiums for health insurance. I think we've really missed a chance to bring down the cost curve and make insurance more affordable for families and for businesses.
So if you were in charge, well, you are in charge in some areas, how would you change it?
Tell my wife that.
How would you tweak it a little bit so you could have said yes?
There are lots of things we can do to change the healthcare delivery model. We pay right now for volume of service, and that's a very expensive, inefficient way. There are ways we could actually improve patient outcomes and lower the cost of healthcare, and that would bring down the cost of health insurance. We should also be able to sell insurance across state lines more easily. I know the Congress passed a bill about exchanges. I would just let insurance companies sell across state lines. I think fixing the insurance model and fixing the healthcare delivery system could really bring down the cost and make it much more affordable for taxpayers, for businesses, and for families.
Now, Congressman's people would say, some cynics would say, well, the reason why you voted on the no side is because that's what your constituents want. I guess that's what a person who we vote into Congress should do, listen to your constituents and vote the way they want. So you got to be honest with everybody, as you always are. Did you really want to vote yes, but you knew your constituents wanted no?
No, I really want to vote yes on real health care reform. I think it's wonderful to try to make it more affordable for working Americans to get access to health insurance. But we didn't actually fix the system. We still have so many inefficiencies in our health care system and our health insurance system that we really missed a chance to make it much, much better. So, of course, I think any real patriotic American would want to vote for really good health care reform. I just think this fell short of what I think we could have accomplished.
So fell short. Other people saying this is a catastrophe. The country is going to really be in trouble over the next 10 years, especially when it comes to money. You don't agree with them. Because when you use the term "fall short," it doesn't sound like it's a catastrophe, like maybe somebody like John Boehner out of Ohio might say.
Well, we already have a couple catastrophes. We got 1 out of 10 Americans, working Americans, who isn't working right now, who wants to find a job. And we've got runaway deficits that I think are threatening to make my kids have to pay off a debt that this generation is creating. So we already have some very, very serious problems. The good news is we can now try to go back in and fix this health care bill and rein in the cost. But I think we had a chance to do it right now, and I think Congress missed the chance to do it. But of course, we still have very serious problems. This unemployment crisis is really very serious for many Americans.
Congressman Adler, thank you for joining us this morning. The debate has not ended, by the way. 7:18 now. What started out as a weekend of